Imagine reliving your worst nightmare over and over again, feeling trapped in a loop of fear and anxiety. This is the reality for many people with PTSD. PTSD, or post-traumatic stress disorder, isn't just a condition that affects soldiers. It can impact anyone who has experienced or witnessed a traumatic event. Feeling shocked and distressed after a traumatic event is normal, but when these feelings persist and disrupt daily life, it could be PTSD. PTSD manifests in three main ways: reliving the event through flashbacks and nightmares, avoiding reminders of the trauma, and feeling constantly on edge. You might find yourself avoiding people or places that remind you of the traumatic event, trying to numb the pain by distracting yourself with work or hobbies. Hypervigilance is another common symptom, where you feel constantly on alert for danger, making it hard to relax or sleep. PTSD can make it difficult to look after yourself, maintain friendships, or hold down a job, affecting every aspect of your life. There are different types of PTSD, including complex PTSD, which can result from repeated trauma like violence or abuse, and delayed onset PTSD, where symptoms appear months later. Traumatic events that can lead to PTSD include serious accidents, life-threatening illnesses, physical or sexual assault, and natural disasters. Certain factors increase the risk of developing PTSD, such as a history of depression or anxiety, lack of support, and prolonged exposure to trauma. Why does PTSD develop? It might be an automatic survival mechanism, keeping you on high alert to protect you from future trauma. High levels of stress hormones and changes in the brain's emotional and memory centers can also contribute to the development of PTSD. But there's hope. PTSD can be treated, even years after the traumatic event. It's never too late to seek help. Talking therapies like trauma-focused cognitive behavioral therapy, TFCBT, and eye movement desensitization and reprocessing, EMDR, are effective treatments for PTSD. TFCBT helps you process the traumatic event and manage overwhelming feelings, while EMDR uses guided eye movements to help your brain process traumatic memories. For complex PTSD, additional support and longer therapy sessions may be needed to build trust and address other issues like dissociation or substance misuse. Medication, such as antidepressants, can also be an option if talking therapies aren't effective or suitable for you. Self-care is crucial. Grounding techniques can help manage flashbacks, and understanding your triggers can prepare you to cope better. Relaxation methods like meditation or listening to music, and talking to someone you trust, can also provide relief. Looking after your physical health by eating well, staying active, and addressing sleep problems can improve your emotional well-being. Remember, you're not alone. There are many resources and organizations ready to support you on your journey to recovery. Reach out and take the first step towards healing.